This is Angela Killens from Columbia Community Mental Health, and she's put together some thoughts about her annual report. Take it away, Angela.
Thank you, Ginger. So we have not made our official report, so I'm just going to kind of share some slides with you as we're pulling it all together of what was requested. So some of the things that our director requested that we show are the number of clients that we served. So for both billable and non-billable services, I thought this was kind of interesting. The number of clients that we served for non-billable services is quite a bit larger than billable services, and that's because we do document non-billable services for medical records requests, just about any interaction we have with clients. So if they're calling in, we do record that in our service list of non-billable services. So that's all of the potential clients or previous clients that we had interaction with, which was kind of interesting in the last year. And then we had percent of clients served by program category. So our mental health outpatient was our largest, and then we had pretty large addictions outpatient and crisis services, our IDD, developmental disabilities, addictions residential, some administrative, and mental health residential is what kind of fell into those categories. And then locations. So our main campus is our Creekside campus. So about 44% of our services were at that location. Actually quite large amount, 28% was community, and then we have some others, 6% school, client resident was 5%, some detox, IDD are different other ones out here. So that was kind of interesting to really show that we are doing a more community services was what we were trying to focus on there. And then percent of services provided by category. So we wanted to show that contrary to belief, a lot of people believe that it's a lot of individual. We do provide a lot of group services as well. This was a goal for us for 2019 was to increase our number of groups provided. So about 48% of ours, so it's about 50-50 in this aspect if you take out the peer and crisis services between individual and groups. So that was a win for us with our objective. And then count of clients who received medical services, so billable services versus non-billable services. Not quite as many non-billable services, more than billable. So on the medical side, and then count of services by prescribers in the medical services. So as you can see, the billable, they provide a lot more billable services than non-billable, and then services by other medical staff. So medical assistants and RNs is the opposite, which is what you'd expect. They provide a lot more support. So non-billable services versus billable services to the prescribers. Number of PCP, so we have a primary care on site, which was new that we just introduced last year, 2018. So we were looking at 2019 and the distinct count of clients served here, and then the count of services provided in that program. Side by side per quarter. So even though the services changed quite a bit, the service count, the actual count of clients being served stayed roughly the same in quarters 2, 3, and 4. And then we were looking at
Angela, I didn't mean to break your stride, but I was going to say on that one before, that was the one we talked about a little of where you kind of could explain why that would be, right? Sorry to break your stride.
Oh, yeah, no problem. So, yeah, we were just talking about that because this was kind of a starting of services. We started late in 2018 and so quarter one, the number of clients was lower, and we were just kind of getting started. And then into quarter two, why we think the services were higher here is because when you're just getting started with the clients, you need to meet with them more often to kind of figure out where they're at and what needs they need, and kind of assessing all those needs for care. And then it kind of steps down as you get to know the client better, and the provider is able to really focus in on what's needed and stabilize the client. So that's kind of what we were thinking of why the service count went down, even though the client count remained about the same.
I think that's a really interesting data set, because if you were only looking at the count of services, it would look like, oh, what's going on? All of a sudden, we're not providing as many services. But if you show the client count in there too, you see that like there was just a higher level of intensity of services for a while, and that it's now maybe stabilizing. And I think with people moving into primary care, that's a really important thing to think about when you're presenting data to like people who might not realize like what the difference is between the count of services versus the count of clients. So I just like that. Sorry. Thanks for letting me jump in there, Angela.
Of course, no problem. Let's see. So then we had for this one, this is our detox facilities. We have a medical detox facility, and we were looking at the number of clients that were admitted one time versus were admitted more than once in 2019. So about 21% of our clients were admitted more than once to our facility, and about 79% just once to our facility. So looking at how many times clients return. It was interesting when I was looking at this data, we actually had one client that actually returned 5 different times in the year. So that was kind of interesting to look at that and what was going on with that client and where they're at now for services. And then services provided in the jail. So we have a new program with the jail where we are providing groups and providing services to people in our county jail. And they're non-billable services that we're providing, and then we're not having to open them up completely into services. We're just there, and they can attend or not attend. It's up to them. And then we do provide some billable services, so that's more of like the assessments when they're trying to get furloughed out of jail and that type of thing, so that accounts for about 32% of that. And then services under our crisis program, billable versus non-billable. So we want to show that it's a very important service that we're providing, of course, with crisis services, but a lot of the time that they're spending is non-billable services. And part of that is because state reporting is a service in our domain. So, and like a PH29, like those are all services. And so they're considered non-billable services. They're just documentation. So it's showing that a lot of the time they're doing what would be considered non-billable services in the aspect of maybe it be a form or a state reporting requirement versus the actual billable service that we can actually send out the door. So showing that. And then count of clients served by school-based health centers, and then just the different school-based health centers that we have and how many clients that we are serving at those different locations. And then we also are going to be including, let me zoom in on this so you can actually see it. So we're really trying to have more of our staff live in the county that we serve. So we were looking at the number of staff that live in county versus out of county, and then by specific cities within the county where we are. And then the percent, the position type. So non-clinical staff versus clinical staff, and then some different titles. And then we're doing comparison of the national salary versus our salary to kind of show based off a couple of different positions. So these are RN positions. These are support specialists, counselor 1 positions, and this is a counselor 2 position. So that information in there, as well as just some basic information about our agency and the services we provide and some of the different directors, and then a financial overview is what's going to eventually pull all together and have a story kind of go with all of these slides is the goal.
Thank you so much for sharing this information with us, Angela. It was great. If anyone has any questions, please feel free to reach out to the Pinnacle team, and we'd be happy to connect you with Angela. Thanks again, Angela. We appreciate it.